This is County Executive Warren Evans, and this is Inside Wayne County.
Hello and welcome to Inside Wayne County. I'm your host, Lloyd Jackson, and this show is designed to give you important information and also keep you informed about what's going on inside Wayne County government. Recently, Wayne County participated in the ribbon cutting of a very exciting new facility in Dearborn. It was actually at the site of the old Dearborn City Hall in the West Annex on Michigan Avenue in Schaefer. It is now called Art Space Lofts, 53 affordable live-work units for low-income artists and their families. I'm very happy to have with me today to talk more about this great project, the mayor of the city of Dearborn, Mayor Jack O'Reilly. Mr. Mayor, it's nice to have you here. Thank you for coming on Inside Wayne County.
Lloyd, thanks for having me.
Wow, what a great event, what a great facility. How did Art Space come in contact with Dearborn? How did that come about?
Well, I reached out to them actually. I went to school with somebody who was from Minneapolis, and so I'd go out and visit him several times, and that's where Art Space really started, although it's all over the country now. Mm-hmm. And so I knew about it, and it was, the height of the recession, 2009, and we're looking for anything we can to generate some new activity and interest. And so we reached out to them. They didn't have any plans for this market because they're in most of the major markets. So They came out, and can you imagine 2009, and we celebrated. So it takes a while to get these things done.
Yeah.
But it's, as you saw, it's really an outstanding project.
How did City Hall come into play in all of this?
Very late in the game, actually.
Okay, so this wasn't something that started at the beginning.
If I thought I had that kind of foresight, I'd be really happy, but I didn't. We just wanted to bring them in to adapt some property in Dearborn. And what happened is during that process, the old ADP building, which had only been occupied by ADP for 10 years, it was custom built for them, the owners put it into bankruptcy. And ADP didn't renew the lease because they had shrunk. They used to have a big mail room. They had all this stuff, and of course, the nature of that all went, just as everything else, is technology driven. So they're still in Dearborn. They moved to a smaller place that Ford Land provided them, and Ford Land built that for them, but then sold it to these investors. So the investors put it into bankruptcy, and it turned out that we could get it for a ridiculously low price. And so it was the perfect thing. We get a modern building. We walk away from $850,000 of deferred maintenance on the City Hall because we sold it as is, and we did sell it. And so now we have a modern building to carry out our services. Our customers, especially like contractors and our other people who do a lot of business with us, are thrilled. But the art space is just phenomenal because it's a catalyst for just creating a new energy, and it's going to attract a lot of other people. We see that. I actually interviewed a couple of mayors and put it on our local cable, and these mayors talked about how it was a catalyst, how it drove new investment and so on. So, it isn't just, I'm not speculating. Yeah. We have evidence that this is really a catalyst for bringing a new energy to an area. And of course, that's one of our oldest business districts, so it's the one that needed the new energy. It's a perfect match.
When you walk in and you see all the art on the walls and you see the sculptures, and then you go into some of the rooms that are now livable space, lofts. There's even, on the first floor, when you turn and you see the mayor, your old office. That's lofts there too. Yeah. How did someone that you spoke with has that office now?
Yes, this is a funny story. My wife and I were visiting the Phoenix Center in Detroit. We were there to look at the artists, and they had an open house, so we were enjoying it. And we're walking from one studio to another. And in one studio, this woman had all this stuff piled up there. I said, what's going on? She says, I couldn't afford where I was living, but I haven't found another place, so I'm storing all my household goods in her little cubby. And I said, well, we're doing art space. Let me give you a card and get a hold of me, and we can hook you up. She ended up applying, got accepted, and she was there. But the irony is, the room she got, because they're all different, is the old mayor's office.
Wow.
So, that was like, I said, somehow that was kismet. Something meant that should happen. But, and again, it's all types of artists. So, and what I learned in the other places I visited and talking to artists is, they become more productive because they see everybody else producing, and it gets them excited.
It's creative. They're creative.
But more importantly, they begin to cross their what they do with other people there, and they begin to partner up and think of new creative ways to do things. And so it's great for the artists. It's great for the community. It's great for the district it's in. And again, like I said, and we really appreciate, because the county and the county executive was very supportive. They helped with this project. The state helped with the project. We had, as you know, we were there. We had major donors and Ford Fund.
This was like a $16.5 million project.
It is $16.5 million. Now I got to walk away from $8.5 million of deferred maintenance, meaning we were behind in that maintenance. They bought the property as is because they gutted everything.
Oh yeah.
Everything in there is new. All the mechanicals, all the service, the plumbing, everything is brand new. But it looks historic. And on top of that, and this is the most important thing for people to understand, we sought to get it for them. We got it designated as a National Historic Site. Okay. Wow. The advantage to that is that there's tax credits from the federal government, and since they're a nonprofit, they can sell those tax, and Bank of America bought them, and that was a $10,000 or $10 million of revenue right there, $10 million from this tax credits. So these are the way, putting these packages together, and that's what took so long, is they're very complex, but when you've got all the partners coming to the table, if you can satisfy them, and that's why I said everybody's support was critical. But at the end of the day, it's a great project, and like I said, the city is in a much better place in terms of customer service too.
And the county executive is, into art. He's a supporter of art, but he's also a supporter of prevailing and affordable housing as well. And this is a win-win.
Oh yeah. Well, we've done other things because we did a Habitat for Humanity project and stuff, and the county again was very in with us. So yeah, this kind of partnership is good for everybody. And we focused ours on returning veterans, and we did 12 units, and all of them are fully accessible for handicap. I mean, it's designed in. You don't even notice it until somebody makes you aware. But we were conscious of veterans who may have mobility issues, so we designed ours in Dearborn to be the perfect place for a family that has somebody who needs that. So,
how does ArtSpace fit into the vision Dearborn?
Well, it fits in the vision because we see the West End is kind of an entertainment center now. We realize that, and with Ford Motor Company investing there, I think we put that in a good position. The East Dearborn traditional business district, it needed to have an identity. It needs to, it's just like Midtown, downtown. I mean, people know what to expect. They know what they're going to get.
That's true.
And so we're trying to create in that business district a renewal around the arts and art. You saw art in the park. We participate in that. We've been in the Inside Out with the museum. And so all of those things are to try and create an image that will have people want to come and know what we're talking about. Oh yeah, let's go there.
Right. What are some of the other things that are going on in Dearborn that you can tell us about in a couple of minutes?
Well, of course, the Ford investment is huge because they've been here almost 100 years, and things were getting tired, and now they're going to renovate everything. Which that commitment. I mean, I can't say enough about the fact that working with them on that commitment, it means that they're saying for another 100 years we're committed to Dearborn. That's powerful. That's really something for our community to know. That's going to be a catalyst, and then we need to just fill out all the other stuff. But it gives us a great start.
And I know the artists, when they were talking at the event, they were really happy too, being across the street from the Arab American Museum.
Well, there's a great partnership. In fact, they're going to move. They've been doing some entrepreneurship stuff. They're going to move into there with that. They're going to do synergy. They've been having world music concerts. We have concert out on the park there. We've had 3,000 people come out for jazz concerts at our in front of there.
Yes.
And then we retain that. The grassy part on the western side is still the cities, and we have our DDA or downriver. They actually program that and so on.
And so that will continue.
That'll continue. Oh yeah, because that's so we're going to be partnering with them on events, all kinds of things. So it's really to get that energy, to get people to think about, hey, let's go see what's going on there. That's and we're talking about that in a lot of places. I mean, I know my children, and I have 3 children. 2 of them now are in Detroit. But they and their friends will go to an area, identify, let's meet here, and then we'll figure out where we're going. And so, that's the kind of thing you want. You want people to say, well, we're not sure what we're going to do tonight. Let's go to this place, and then we'll figure it out from there. You want to be that place. And we're seeing it, obviously, in Detroit in a very strong way, and other communities around us, and we're going to be seeing it in Dearborn, too.
Well, Mayor O'Reilly, it's a pleasure having you on the show. ArtSpace is great, and congratulations on having ArtSpace come into Dearborn and going after them, and just having a win-win with them being in the old City Hall and you guys able to move to your new facility as well, and cost savings and a lot of fun for the community and a lot of walkable areas, and it's just going to be a lot of fun in Dearborn. Yeah,
and it's really great that we have this synergy where the levels of government are all working together. That hasn't always happened, and with the executive and with even the state and so on, I can see right now we're in a mode where we're all trying to move in the same direction, and that's going to be powerful.
Thank you so much for being here on Inside Wayne County.
Thank you very much.
When we come back, we'll be back with Dr. Mouhanad Hamammi. We'll be talking about a new dental clinic that's open in the Wayne Health Center in Wayne, Michigan, when we return.
My name's Reggie. Just recently, my wife and I took in her sister's children. Now, we already had 4, so I went from becoming a family man to a man with a bigger family. Now, you can't eat love, so I don't know how I'm gonna feed them tonight. How was that, Rich?
I think I look more like Denzel.
That's cold, man.
Play a role in ending hunger. Visit feedingamerica.org/hunger and find your local food bank.
The first day stepping on the court, I couldn't keep up. That motivated me to step up my game. When I reach a goal, I set a new one the next day. And my next goal is to go to college. Mastering the court takes persistence. So does getting into college. I've got what it takes. So do you.
Wake the sun, tell him that I've begun to dream of things to come, and tell the trees not to look for me. I'm going to find some peace of mind. Wake the sun, wake the sun, wake the sun, wake the sun.
Welcome back to Inside Wayne County. I'm your host, Lloyd Jackson. And back in March of this year, we cut the ribbon on our second federally qualified health clinic in Wayne, Michigan. We announced our partnership with Beaumont Health and the additional services we would provide to patients at the Wayne Health Center. One of those services, which was not complete at the time of the opening, was our new dental suite. Well, it's open now, and to tell us more about it and other partnerships, we have with us the Director of the Department of Health, Veterans, and Community Wellness, Dr. Mouhanad Hamammi. Dr. Hamammi, thank you for coming back to Inside Wayne County.
Oh, it was a pleasure to be back, Lloyd.
Before we get started with the dental clinic, I just had on the Mayor of Dearborn, and we were talking about ArtSpace. You were there at ArtSpace. You stepped in for the county executive to speak. Talk about ArtSpace and how that fits into overall wellness.
Oh, first of all, let me tell you, this was an amazing event. It was an amazing idea. I am very happy that Dearborn is truly this innovative medium where we can implement some of those ideas. But what you mentioned is absolutely correct. I mean, we've always talked, and especially on this show, we talked about the complete 8 dimensions of wellness, and that in order for a community to be well, then you need to establish all of those domains. And definitely art space fits right within that concept, because we're talking about, one is promoting the arts, which is the intellectual wellness as well as educational wellness. And then we're talking about affordable housing, which is physical and financial as well as economical wellness. So this project has hit on all those aspects, and it is great to see the diversity of what those artists are going to bring to the city and how they are going to be now part of the fabric of what Dearborn is. And I was very thrilled and was very honored that I was part of that and was able to represent the county, and specifically Mr. Evans.
Now let's get to the dental center, the dental clinic at the Wayne Health Center. It was not open at the time we had the grand opening. It's open now. They're taking patients. It's a wonderful facility. Tell me about that and your thoughts on the new dental clinic.
So as you know, the federally qualified health center, or community health center that is in the city of Wayne, should be a fully comprehensive service provider. So we do provide primary care and we do provide behavioral health. What was missing was the dental component. And it wasn't missing because of a choice. It was just we were preparing the dental suite. We have been very fortunate that we collaborated with the University of Detroit Mercy Dental School, with Dean Oksu and his team. We were able to not only benefit from the partnership as the workforce, which we're going to talk about, but also they were generous enough to donate some of the equipment. So for example, we had 12 dental chairs that were donated by the school, 5 of which are now in use at the dental suite in our Wayne Health Center. The partnership that we established is that this is going to benefit both entities in a mutual way. So we benefit from the expertise that the university has, and the university is going to provide us with an attending physician as well as students that can treat patients. So now we are almost a teaching center where we're teaching the residents under supervision of the attending dentist, but we're also providing services to those that need them the most. So it's a win-win situation, and we're very happy that we were able to get it off the ground, and we're now seeing patients.
And when you talk about this dental clinic, we're not just talking about screenings and cleanings, we're talking about the whole gambit.
It's a full-service dental clinic. We provide all services from restorative dentistry to fillings, extractions, all that. In a combination, of course, we always talk about prevention and screening, so there'll be cleanings, there'll be the varnish layouts and all those, and of course, our goal is to also use it as a educational tool where we talk about the importance of dental hygiene and taking care of your teeth. You know that our Wayne Clinic sees a lot of children that come for immunization or for WIC. Yes. So pediatric dentistry is something that Michigan isn't very, there isn't enough pediatric dentists in the state, and we're happy that through the university we will have the tools and we will have the opportunity to educate children from the early age on how to take care of their teeth.
And I don't think people really realize so much that oral health is so very important when it comes to overall health.
Absolutely, absolutely. There are so many disorders and so many conditions that are connected and vice versa. So having healthy teeth is truly an important gateway to having perfect health, basically.
So in this area where the Wayne Health Clinic is, you've got about 112,000 people there. Half of those are below the poverty line, and then you have about 41% that are like 200% below the poverty line. So this is really needed in this area.
It is, absolutely, and that was the idea when we started looking on where we're going to open our next federally qualified health center. And we chose the city of Wayne because of the population we serve. There are, not only it's a medically underserved population, but it's also what is called a dental shortage area. That means the number of dentists per population are low, where the federal government assigned this as a dental shortage area. So we're happy that we are able to bring back dental services to the health department, and now this partnership with the university is again, it's a win-win situation.
I was out there, I saw the dentists working, I saw the students working. It's a great facility, and they're so What I was impressed with, Dr. H, is they were so good with the children. Because a lot of kids, like you said, a lot of kids come in and sometimes they haven't gone to the dentist, and so it's a different type of thing for them. But these young people are so good with them.
You know, you're funny. You mentioned that. Going back to my childhood, I know I wasn't happy visiting the dentist. I'm not sure anybody is happy in doing that, but you're absolutely right. We're talking about the best of the best in terms of patient care, in terms of customer care, not only our staff, but also our folks from the university. And these are the experts. They know how to handle children, and they know how to handle all ages. But I think the most amazing thing is when that child that is, a little bit apprehensive, a little bit scared, and he sits on the chair, and after the screening, he gets you have no cavities, and you can see the smile on his face. And it is amazing. It's truly a great feeling.
Now, let's talk about insurance, because I know that people watching want to know more about the dental clinic and can they come. So there are insurances that are taken, but nobody's turned away. How does this work?
Absolutely. So again, this is what a federally qualified health center. So not only for dental services, but for every service that we provide at the clinic, no one is going to be turned away. If you have insurance, we will bill your insurance. If you do not have insurance, then based on a sliding fee scale, we calculate what you might owe for that portion of the visit. So a sliding fee scale, as you know, is a calculation based on the family income, the number of households in the family, and it can be that you only owe 10% of the total bill, or it can be that you owe more than that. But either way, no one is going to be denied services because they cannot afford it. And this is exactly what we want to emphasize. The reason the county got back into providing direct care is because we wanted to ensure that access to care is truly a right. It's not a privilege.
Well, the dental suite is open 5 days a week from 9 a.m. to 3 p.m. in the Wayne Health Clinic. That's located at 33030 Van Born Road in Wayne, Michigan. And you can make an appointment if you call 734-727-7101. That's 734-727-7101. Before I let you go, Dr. H, I have to ask you about the Wayne Health Clinic and just talk about more of the services that are provided there that were not provided before the FQHC opened up.
Right. So we continue to provide primary care services, so everything related to clinical care, from pediatrics to OBGYN to adult medicine. Anything that you need is provided there, and this continues through our partnership with Beaumont Health System and the family medicine program at Beaumont Wayne.
So we have Beaumont doctors in our clinic?
Absolutely, yes. We have Beaumont doctors at our clinic. Dr. Weaver is one of our now regular doctors. She's always there at the clinic, and our patients are loving the experience they're getting. And the beauty about this model is that our now public health nurses and the clinic staff are working hand in hand. They are now in the same rooms. When a mother comes in for immunizations, then our public health nurses are providing the immunizations. They walk out. If she needs to see a pediatrician, the pediatrician steps in. There is no need to go anywhere. It's all happening under the same roof within the same room. So again, this model is definitely beneficial to ensure that there is no burden on our families and our county residents when they want to seek medical care. So primary care is offered. We are now also doing on a set frequency some behavioral health assessments. So mental health and behavioral health is also offered at the clinic. The dental, as we mentioned, and then everything that a health department should be able to provide, such as WIC, and immunizations, screening for sexually transmitted diseases, HIV, hearing and vision screening. All those are also part of what we offer at the clinic.
And physicals as well.
Absolutely.
And I want to talk to you about physicals, because with a physical, there are so many different screenings that happen during the physical that you can actually find out if something's going wrong pretty early, and that's very important.
It is. And I encourage everybody to make sure that they get a complete physical once a year, because, as you said, it is the opportunity to find out if there is anything, God forbids, that requires further assessment. And many times, you know, we go into life and we are so busy and we're so engulfed in our day-to-day activities, and unfortunately we fall into the practice that we're not going to go see a doctor until something is wrong. Well, sometimes something might be wrong, but we don't know about it. And this is where a physical or a checkup is going to be very important in identifying that.
I would think also too, Dr. H, that with this partnership with Beaumont, it helps them as well, because maybe it keeps people from going to emergency rooms all the time for the doctor, just for a doctor's visit. They run to the emergency room, they can come to our Wayne Health Clinic as you know, instead.
Definitely. And you know, we call them the frequent flyers. The frequent flyers are those that seek at least 80% of their medical care at emergency rooms. And unfortunately, these are the ones that are underserved. These are the ones that probably do not have a regular primary care doctor, or these are the ones that work all day, and whenever they need clinical care, then the only option is after hours. So that's why with having the health center, and we have our extended hours, as you know, on Wednesdays, then we definitely are going to see a drop in those frequent flyers that are using the emergency room for their clinical care. Not only that will benefit the patients, but it also will benefit our partners, the health systems, and also us as taxpayers, because you can imagine how more expensive it's going to be if you seek your health care through emergency rooms rather than a primary care facility.
I want the viewers to also know, Dr. H, about our clinic in Hamtramck, because we do have one in Hamtramck as well.
Yes, that is actually, that's my pride and joy. That's the first one. We should never forget about that. And the clinic in Hamtramck is exactly the mirror image of what we have in Wayne. We provide exactly the same services. What is so beautiful about the clinic in Hamtramck is that it is truly immersed in the fabric of the city, and we match the community. We have multi-diverse and backgrounds and ethnicities in the clinic staff that matches the ethnicities in the in Hamtramck, and we're very happy with how we are now working with the different community organizations and offering our services, and making sure that the residents of Hamtramck are also receiving the best care that they need.
And I just want to touch a little bit on No Wrong Door as well, that concept that we're promoting here at the Department of Health, Veterans, and Community Wellness.
So I don't know, has it been a year since we probably announced it on this show a year ago? I'm happy to tell you that we are in now the first stage of implementing this, and we have been training our staff members and getting them to navigate. We have at least 250 services that we provide under this department, and these services can vary from applying for a cause of death certificate all the way to getting dental care. So it's a very vast range of services, and I would not expect one person to know all the services like they should be. So the No Wrong Door is a two-way thing where, one, we're educating all our customer representatives, all those that are staff members that interact with clients and county residents, to be familiar with what services we have, and then also assess, kind of like a case manager, assess what are the needs of this mother that came in for WIC. Okay, she came in for WIC, but maybe she needs something else. Maybe there's someone in her household that needs something else. So we're almost 70% of our staff have been trained through the initial phase of screening and how to navigate. We have a huge catalog that we're trying to automate as well. We're looking at ways, and I hope that this is the next phase of the No Wrong Door, of how can we have it as a self-service tool. So you can go online and type in, I need this service, and then by just checking on boxes, then a final report would say, okay, you have an appointment for this service, but you might qualify for A, B, C, D, and do you want to make an appointment? So that is the ultimate goal of the No Wrong Door. We're getting there slowly but steadily, as they say.
Dr. Hamammi, it was a pleasure having you back on Inside Wayne County. Thank you so much.
Always good to be back, Lloyd. Thank you.
Stay tuned for upcoming shows as I take you inside Wayne County departments, programs, and services. It's all with the goal of keeping you up to date with everything going on inside Wayne County. Thanks to Dr. Hamammi and also Mayor Jack O'Reilly of Dearborn. I'm Lloyd Jackson. See you next time.